Could you please begin by introducing yourself?
Good morning, Sarah. First and foremost, I want to express my sincere gratitude for this opportunity to speak with you today. Thank you for considering my application for the ICU nurse position within the esteemed UK NHS. My name is Mihiraa, and I bring 8 years of dedicated experience in critical care nursing to the table. Throughout my career, I've had the privilege of working in various challenging environments, honing my skills and deepening my passion for providing top-notch patient care. In my most recent role, I served as an ICU nurse at St. Thomas Hospital. Over the span of 5 years in this position, I've been entrusted with significant responsibilities, including overseeing the care of critically ill patients, collaborating with interdisciplinary teams to develop comprehensive care plans, and administering complex treatments and interventions. I'm particularly proud of receiving the Nurse of the Year award in 2022, which reflects my commitment to excellence in patient care and clinical practice. In addition to my extensive experience, I hold certifications in Advanced Cardiac Life Support, ACLS, and Basic Life Support, BLS, which further validate my expertise in critical care nursing. As for describing myself, I would say that I'm a compassionate and dedicated healthcare professional who thrives in fast-paced and high-pressure environments. I'm known for my strong communication skills, my ability to remain calm under pressure, and my unwavering commitment to delivering exceptional patient care. Outside of work, I enjoy hiking in the countryside. I find that spending time outdoors helps me recharge and brings a sense of fulfillment to my life, ultimately enhancing my effectiveness as a nurse. In closing, I am incredibly excited about the opportunity to join the UK NHS team and contribute my skills and expertise to the provision of outstanding patient care. Thank you once again for considering my application. I look forward to the possibility of working together to make a positive impact on the lives of our patients.
What are the responsibilities of an ICU nurse?
As an ICU nurse, my responsibilities are multifaceted and vital to ensuring the well-being of critically ill patients under my care. Firstly, I monitor and assess patients in the ICU around the clock, vigilantly observing their vital signs, response to treatment, and overall condition to detect any changes or deterioration promptly. Administering medications and critical care therapies is another crucial aspect of my role. I ensure that patients receive their prescribed medications accurately and on time, while also administering life-saving interventions and therapies as necessary to stabilize their condition. Providing comprehensive care for patients' physical needs is paramount. This involves everything from assisting with personal hygiene and ensuring proper nutrition to managing pain and discomfort effectively, all while maintaining a sterile and safe environment to prevent infections and complications. Collaboration is key in the ICU setting. I work closely with a multidisciplinary healthcare team, including physicians, surgeons, respiratory therapists, and others, to develop and implement individualized care plans tailored to each patient's specific needs and conditions. Communication plays a vital role in ensuring the well-being of both patients and their families. I regularly update and communicate with patients' families about their loved one's condition, treatment plan, and prognosis, providing support and reassurance during what can be a stressful and challenging time. Depending on the specific ICU, I may also assist with various procedures, such as intubation, central line placements, or bedside surgeries, utilizing my expertise and training to ensure the safety and comfort of the patient throughout the process. Lastly, education is a fundamental aspect of my role as an ICU nurse. I take the time to educate patients and their families about their condition, treatment options, and self-care techniques, empowering them to actively participate in their recovery journey and make informed decisions about their health care. In summary, as an ICU nurse, my responsibilities encompass a wide range of critical tasks aimed at providing compassionate, high-quality care to critically ill patients while supporting their families through what can be a challenging and uncertain time.
What qualities do you believe are important for an ICU nurse to possess?
As an ICU nurse, I firmly believe that possessing a diverse range of qualities is essential to effectively fulfill the demands of this critical role within the healthcare system. Firstly, clinical expertise forms the bedrock of our practice. A strong foundation in critical care nursing, including knowledge of advanced life support, ventilation management, and pharmacology, enables us to deliver high-quality care to our patients in their most vulnerable moments. Building on this foundation, critical thinking and problem-solving skills are paramount in the ICU setting. We encounter complex situations on a daily basis, requiring us to assess and prioritize care, make sound decisions under pressure, and adapt quickly to evolving circumstances to ensure the best possible outcomes for our patients. Moreover, effective communication is another indispensable quality. Whether it's conveying vital information to colleagues during a medical emergency, explaining treatment options to patients and their families, or providing emotional support during difficult conversations. Clear and empathetic communication is essential to fostering trust and collaboration within the healthcare team. Compassion and empathy lie at the heart of our practice as ICU nurses. We understand the immense emotional toll that critical illness can take on patients and their loved ones, and we strive to provide not only expert medical care, but also compassionate support and reassurance throughout their journey toward recovery. Furthermore, teamwork and collaboration are intrinsic to the ICU environment. We work closely with doctors, nurses, respiratory therapists, and other healthcare professionals to deliver holistic and coordinated care to our patients, recognizing that each member of the team brings unique expertise and insights to the table. Stress resilience is a key attribute for ICU nurses. The fast-paced, high-pressure nature of our work demands the ability to remain calm and focused in the face of adversity, managing both the emotional and physical demands of our profession with grace and professionalism. Attention to detail is also critical in our role. We meticulously monitor our patients, recognizing subtle changes in their condition and responding proactively to prevent complications and ensure their safety and well-being. Finally, adaptability is essential. The ICU is a dynamic and ever-changing environment, and we must be prepared to respond quickly and effectively to new challenges, adjusting our care plans and approaches as needed to meet the evolving needs of our patients. In summary, the qualities of an effective ICU nurse encompass a blend of clinical expertise, critical thinking, communication skills, compassion, teamwork, resilience, attention to detail, and adaptability. It is through the embodiment of these qualities that we are able to provide the highest standard of care to our patients and make a meaningful difference in their lives.
What specific physical actions would you take when attending to a patient at their bedside who is experiencing pain?
During my shift in the ICU, I encountered a patient who was experiencing significant pain despite receiving pain medication. My objective was to address the patient's pain effectively while ensuring their comfort and well-being. Approaching the patient's bedside calmly, I introduced myself, establishing trust and rapport. Conducting a thorough pain assessment, I identified the location, intensity, and any factors exacerbating or alleviating the pain. After reassuring the patient of my commitment to their comfort, I administered prescribed pain medication, monitoring for any adverse reactions and ensuring proper dosing. Alongside pharmacological interventions, I implemented non-pharmacological techniques such as optimal positioning, heat or cold therapy, and distraction methods like relaxation exercises or music therapy. Maintaining open communication with the patient, I encouraged them to express concerns or preferences regarding their pain management. Collaborating closely with the healthcare team, including consulting the attending physician if necessary, ensured an adjusted pain management plan tailored to the patient's needs. As a result of these interventions, the patient experienced a significant reduction in pain and reported increased comfort. This contributed to their overall well-being and facilitated their recovery process. Reflecting on this experience, I recognize the importance of prompt assessment, personalized intervention, and effective communication in achieving positive patient outcomes. Moving forward, I remain dedicated to providing compassionate and comprehensive pain management to all patients under my care.
What strategies will you employ to provide support and mentorship to junior staff members?
As a senior nurse in the ICU department, I frequently encounter opportunities to support and mentor junior staff members who are navigating the complexities of critical care nursing. My task is to provide effective mentorship and support to junior staff, ensuring their professional growth and contributing to the overall success of our healthcare team. To achieve this task, I employ a multifaceted approach. Firstly, I create a welcoming and supportive environment by fostering open communication and encouraging questions. I ensure that junior staff feel comfortable approaching me for guidance by being approachable and available. Additionally, I celebrate their successes and acknowledge their contributions to reinforce their value within the team. I tailor mentorship to the individual learning needs of junior staff. Through discussions and observations, I identify areas for growth and development. I offer guidance and resources specific to their interests and goals and provide opportunities for shadowing and hands-on learning experiences to enhance their skill set. Regular feedback and development are crucial aspects of mentorship. I schedule regular one-on-one meetings to discuss progress and challenges, providing constructive feedback focusing on strengths and areas for improvement. By setting clear goals and expectations, I guide their development trajectory effectively. Moreover, I facilitate learning opportunities by encouraging participation in relevant training courses and workshops, sharing learning materials and resources, and connecting them with opportunities to learn from other senior colleagues. As a result of these actions, junior staff members experience significant professional growth and development. They demonstrate increased confidence and competence in their roles, contributing positively to patient care outcomes and the overall success of our healthcare team. Reflecting on this approach, I find it to be highly effective in supporting and mentoring junior staff members. By creating a supportive environment, tailoring mentorship, providing regular feedback, facilitating learning opportunities, and promoting collaboration, I contribute to the continuous professional development of junior staff and enhance the overall quality of care provided within the ICU department.
How do you communicate with critically ill patients and family members?
In my role as a nurse in the city hospital, I frequently encounter situations where effective communication with critically ill patients and their family members is paramount. My task is to establish trust, provide clear information, and offer support to both patients and their families during challenging times. To achieve this task, I employ a compassionate and empathetic approach to communication. Firstly, I ensure that I am approachable and available to address any concerns or questions that patients or their families may have. I make myself visible and accessible, actively seeking opportunities to engage in meaningful conversations. When communicating with critically ill patients, I prioritize clarity and simplicity. I use plain language and avoid medical jargon, ensuring that they understand their condition, treatment options, and prognosis. I also encourage them to express their preferences and concerns, actively listening to their needs and providing reassurance and support. Similarly, when communicating with family members, I recognize the importance of empathy and sensitivity. I provide regular updates on the patient's condition, acknowledging the emotional impact of the situation and offering support and guidance. I foster open communication, encouraging family members to ask questions and express their feelings, and I provide information in a compassionate and honest manner. As a result of these actions, patients and their family members feel supported, informed, and empowered to make decisions about their care. Patients report feeling more at ease and confident in their treatment plan, while family members express gratitude for the clarity and support provided during difficult times. Reflecting on this approach, I find it to be highly effective in facilitating communication with critically ill patients and their family members. By prioritizing empathy, clarity, and support, I am able to establish trust and foster meaningful connections with both patients and their families, ultimately enhancing the overall quality of care provided within the ICU department.